My name is Lauren Long. I am a dental therapist based in Edinburgh in the UK. I write articles, I do clinical education, and I am a key opinion leader for several dental companies. I also work with Pain Free Dentistry Group in Scotland, managing a group of 20 to 30 dental therapists, clinically mentoring them and educating them, making sure that they can work to the best of their abilities. So as dental hygienists in the UK, we can perform routine care for patients, we can perform non-surgical periodontal therapy, we can also give anaesthesia, we can take radiographs, we can diagnose patients as well as treat them via a direct access route. The only restrictions really that we have are for kind of surgical procedures, so anything that is a surgical procedure in periodontology then we can't carry out, but we can treat any level of disease in the UK. So in our country, as I say, as a dental hygienist or a dental therapist, you can assess, you can diagnose a patient and you can treat them. The only thing that sometimes holds us back a little is that we still need to have a prescription for anaesthetics. So that still needs to be given to us by a dentist, or we have to have a document that is signed by a dentist and a pharmacist to allow us to use anaesthetics. I know this is slightly different from some other countries in that some countries can just use like a topical anaesthesia. They can't use infiltrations or anything like that, whereas we can. Having direct access, as I said, is very useful in that we can help more patients. You know, it's very patient-centred care in that they're not having to see more clinicians than they need to, and it allows us just to treat everyone holistically and to the best of our ability. So in the future, I think our profession will continue to evolve. I mean, dentistry is an industry where there's always evolution going on, there's always continuing education that needs to be done. I think that the main thing will be, trying to keep up with those developments. I think that all our modes of treatment, whether it be, ultrasonic scalers, whether it be air polishing, whether it be hands and instrumentation, I think those will all have their place in the future. But I think, I'm very passionate about treating patients holistically, as I mentioned. So, I think tailoring your treatment to the patient is becoming more mainstream in the UK rather than a one-size-fits-all approach. I really believe that will be key in our future as a profession, and also kind of tailoring appointment lengths, different modes of treatment. I think will be key in the future for us as a profession.